Clinical depression goes by many names: depression, the blues, biological depression, major depression, but it all really refers to the same thing, and that's feeling sad or depressed for weeks or even months and not just passing a blue mood. Here today with a library of resources on how to educate and treat this is Christine Gorgas with the Gulf Coast Clinical Research Center. Good morning, Christine.
Good morning.
Thanks for coming back.
No problem. Thanks for having me.
We love having you here. So let's talk about depression.
Yes.
First of all, the name. What is major depressive disorder? I know we talked about when you say major, that can kind of scare people a little bit. So
absolutely, and we try and stress to patients not to get caught up in the name. It's simply the classification in the DSM-4 that categorizes the type of symptoms a patient is experiencing. The major has nothing to do with the level of severity of the depression. It's simply the classification of the name. So some patients call and say, well, I'm depressed, but I'm not majorly depressed. It's like, well, there is no mild depressive disorder. It all comes under that title of major depressive disorder.
I think I would answer the same way. It would make me feel a little better about myself maybe if I didn't say majorly.
Exactly.
What are some of the symptoms that you're feeling if you think that you might have major depressive disorder? What are you dealing with?
Everybody, as we've always discussed, can feel down or low at different periods, but this is a pervasive feeling of sadness that it goes beyond just your circumstances. It's not just that you're sad because of a loss of a job. It goes beyond that. It's a sadness that you can't seem to pull yourself out of. Another major symptom is a loss of interest in things around you. You have no interest in your friends or your family. It takes so much effort for you to get up and get going. Then we have feelings of issues with concentration, issues with energy, sleep disturbance, trouble falling asleep, trouble staying asleep, changes in your weight or your appetite. A lot of patients will say food just doesn't have flavor anymore. I just don't even enjoy it. They've lost their craving. They've just lost their enjoyment for life. And then unfortunately, one of the major symptoms that comes with MDD is that thought of suicide. And we've always discussed with patients, this can be as active as I really do have a feeling or wish to die, and as passive as simply, if I fell asleep tonight and didn't wake up, I'd be okay with that because they've lost that enjoyment for life.
Isn't that so sad just listening to you say that? Because I actually have people close to me that deal with this, and it really does change my way of thinking hearing you say it's the loss of wanting to do this, the sadness, and really hearing it from somebody else makes it sit a little bit differently.
It's something that usually loved ones will point out to people the symptoms that they notice, that you're not really enjoying anything anymore. You just seem sad or down. Patients with depression really do try and put on a good front. They try and put on a good face for everyone that they love. And it's important that they understand that these are very common symptoms. There are medications that can help with this so that patients can go back to enjoying their life, just not getting by day to day.
And so that is the good thing. There are treatments and ways to help
There are
it
definitely
and fix
treatments.
this. So I know there's modern medication nowadays that really helps this. What are some ways that we can treat this? And
the typical treatment for depression is the antidepressants. They fall into two categories. They're the SSRIs, the serotonin selective reuptake inhibitor, and the SNRIs, which work on serotonin and norepinephrine. There are a number of them out on the market today, both in trade and generic formulation. A lot of the SNRIs just came off of their patents, so they are available generic, so a little less expensive. But the key here is that although they've been proven effective in clinical research trials like we do at Gulf Coast, not every medication is going to work for every patient. It's really a trial and error. It's really a conversation with your doctor about how the medication makes you feel, what symptoms you are still experiencing, what side effects, so that you can find the right combination of the medication for you.
And I want to go back to the symptoms too real quick, because not everybody all experiences all of the symptoms or all of the same ones. Like you mentioned suicide, you can still be depressed and not necessarily be feeling like...
Absolutely. And some patients don't relate to all of those symptoms, but it's important to take a look at the body of those symptoms and see, am I falling into this category? Or at least half of the symptoms am I experiencing? And am I experiencing them on a routine basis? A lot of patients, especially men, will relate more to the physical symptoms. I'm not sleeping, I'm having problems concentrating, but it's important to be honest about all of the symptoms, because if you go in because you're only comfortable talking about a couple, it can lead to misdiagnosis, it can lead to the wrong medication for you. So you really need to look at all the symptoms. You can always go on our website, gulfcoastclinicalresearch.com. We have a lot of different information available to patients to take a look at what the symptoms are, different questionnaires, and the most important thing is to be honest with yourself about how you're feeling. This is not a mask to put on for other people. To be honest with yourself so you can communicate effectively to a physician and get the right treatment for you.
And I think it's so important to know that you know, it's comforting to know that there are a lot of people that deal with this and you don't have to be embarrassed about it.
Absolutely not.
So be honest, go in there and talk to a professional about what you're dealing with, and in the outcome you're gonna feel a lot better.
Absolutely. We work every day with patients and community resources to try and remove that stigma with depression. It's unfortunate. It's an illness just like any other illness. There's medication to be able to treat it, and the best thing that you can do is just be honest and brave and start talking about it, because there is help.
Okay, well, we're glad there's people out there like you in Gulf Coast to help. Give us that website one more time.
It's www.gulfcoastclinicalresearch.com.
Okay.
You can always take an anonymous screening tool, or always feel free to give us a call if you have any questions.
Okay, perfect. All right, thank you so much for being here,
Thank
Christine.
you.
We'll send it over to Carly.